Good morning, good afternoon, everybody. Welcome to the Thursday Practitioners Team Call. My name is Kathleen Nichols. I'm a Senior Presidential Director here with Lifewave, and we gather on Thursday mornings to hear from our doctors and learn more in depth about the science and technology. So I am filling in for Marcy Preble today, so thank you all for joining us. And I am co-host here with my beautiful Jan Rand, so thanks for joining us, Jan. And so today we have the lovely Dr. Patty as our guest again. And I would just like to invite Dr. Patty to come up and just, introduce yourself. Tell us a little bit about you. I know we have some people on here that know you, but also some new people that don't know you.
Great. Well, thank you. Kathleen, appreciate you always being here and helping Marcy out today. And Jan, we're so grateful for you. I'm a medical doctor. I went to medical school midlife as a second career, and I was a music teacher in the first part of my life. I'd always been interested in medicine and done a lot of study in naturopathic, holistic medicine as a music teacher, just a layperson. And I wanted to go to medical school to learn more, get those credentials, and continue to use the holistic tools as well. And of course, Lifewave patches are wonderful in that area of being so holistic. So it's great to be here. I have a practice now of functional and regenerative medicine. I've worked in corporate medicine. I've worked at Kaiser. I've done a number of different, stints in my doctor career. And now I have my own clinic as well as assisting other clinics to do all of this wonderful integrative functional medicine.
Amazing. Your background always is so impressive to me, Dr. Patty, that you in midlife, midstream went for a whole second career. It's absolutely astounding and so applauding. So again, thank you for being with us today. And so I think today we're going to go over like heart health and energy. So I was going to start with, what even happens with a heart attack? Like, what happens with our heart? How does it age, and why does it age? And what is a heart attack?
Well, so as we know, heart disease is one of the major killers overall. Interestingly enough, my first husband passed away with one of those, what we call sudden death, myocardial infarction, MI in medicine, or heart attack in lay people's terms. He was actually very healthy, but he had a congenital heart defect, and he stepped off a treadmill, and literally his heart went into an irregular rhythm that stopped it. And there was no one there in the gym at that moment in time to rescue him. And so he passed away. So we know it's super serious. And we also know that many people live with coronary artery disease, the arteries that feed into the heart, and they get blocked. And when the blood doesn't get to the heart, that's the whole root of it. If you don't get your blood flow to the heart, you have to have a good rhythm and you have to get blood flow there, then you're going to have a problem. And so we love that our Lifewave patches can help us in many ways. And then, of course, in functional medicine, we know that lifestyle counts. So we have to, and David Schmidt emphasizes this over and over again, we have to get the right vitamins and minerals into our body. We have to drink plenty of water, and we have to keep our bodies moving. I always say, move or you die, right? We want to give our body that message. We're not done with it yet. We're going to keep moving.
Yes, I love that message. When you're moving, you're telling your body that you want to be alive and that you're excited to engage in life and be a participant.
Right, exactly.
So then what I just heard you say is there's actually a couple different ways that the heart can stop and we transition. And so with the patch, how would the patch help our body to not do that?
Well, so as we know here in this group, our main patch that we all want to be using and encourage our patients and clients to be using is the X39. Our X39 is the foundation for all of our health. And so it is very important. And of course, in its help with energy and with sleep and with pain and with activating GHK copper, which is a peptide in our body that is helps us to be as youthful as possible. And that GHK copper peptide stimulates stem cell activation in our body. I mean, my gosh, we have to be on X39, right? Because that's going to be the foundation. Today, we're going to talk a little bit about the energy enhancer patches. And now they work in a number of ways in the body. But one of the ways is that they help to increase our heart rate variability. And that sounds like a big sort of phrase, but all it means is that our heart rate is supposed to be going up and down. It's supposed to be varying, and that's a measure of health. One of the things the energy patches do, we know our heart, right? Many of you have probably gotten an EKG or an ECG, they call it in other countries. You've gotten that before on your heart. And they hook you up to this little machine, and they put these little electrodes on different places around your heart, because your heart is electrical. It conducts electricity. And so the energy patches help our heart to conduct electricity better, to keep that heart rate variability going, which is very much a part of being youthful and healthy and well. And so that's sort of where we start with the energy enhancer patches and how they can supplement what we're using with X39 to give us truly more energy, or at least the potential for that. And again, today, as a doctor, I'm not giving medical advice. I'm not treating diseases. And we need to make certain that everybody understands that. But we are sharing our experience, strengths and hope, right? We're sharing experiences with patients. And maybe this can be helpful to other people here as well.
Thank you, Dr. Patty. And yes, absolutely, our medical disclaimer that here at Lifewave, we're not treating, curing, diagnosing, or preventing any diseases at all. We're just talking about the patches, the technology, and how they're helping our individual situations. So
Yes.
Thank you for reminding us about that.
Yes.
So I didn't know any of that, Patty. I did not, Dr. Patty, I did not know. I've heard the term heart rate variability. And so what I understood you to say is that for a healthy heart, it needs to be going up and down and have different speeding up races and slowing down heartbeat. So there is, the more it varies and the more you rest and then do exercise, or rest and do exercise, that's actually an indication of heart health, is that variability.
That's right. And sometimes people that use their watches, or they have Oura rings, or they have ways to measure the heart. And my son's an interventional cardiologist, and he and I often work together on functional medicine cases. And what's interesting is sometimes people will send us, their results, and they'll go, "Oh, look, my heart is doing like this," and it's like, actually, that's good. What you don't want is flatline, right? We all know flatline means you're dead. So we want to have some heart rate variability for sure. And that helps keep our metabolism up. The energy enhancer patches are very good in that the way they give us energy is by burning fat. Now, isn't that awesome? We all like to have a little fat burned, a little more than normal, right? And so what's so interesting to me about the energy enhancer patches is that David Schmidt developed these first. And so he was working with a group of Navy SEALs, and they were, had just crazy schedules, didn't sleep much, were always having to use stimulants to get themselves going. And so he began to develop something. And remember, that's what's so cool. Everything you read about anywhere else to get energy, it's some kind of a stimulant, right? And no, that's not the way our patches work. As we know, they're light activated. They activate normal pathways in our body. And so that's what's so beautiful about those patches. So not only do we get that heart rate variability, but we get increased energy through the mitochondria. And we'll probably talk a little bit more about the mitochondria today too.
Okay, excellent. So just to get that one point, so the energy enhancer conducts electricity better to keep our heart rate variability happening.
That's correct.
Okay, excellent. And so it's one of our two patches that have a two-patch system. So can you explain how the technology works with that two-patch system and how that energy enhancer patch actually works?
Is that a loud noise that I need to move to another room? Are you guys okay with that for a minute? Do I need to move?
You're good.
Okay, okay, great. So I actually wore my energy enhancer patches today, right next to my X39. This is the common way I place mine. I have my X39 here. Now I do use X39 where the studies have shown it to be effective, which is 2 finger widths under your belly button and behind your, on the back of your neck. But I have a sore wrist. Marcy and I both have a sore wrist, and I use it often on my wrist, especially when I'm using my energy enhancers. But you can see the energy enhancer, can you see that has a white, and you use a second one on the left. So now most of our patches, we just use one, right? But energy enhancer, ice wave, we use 2. And the reason is because we're trying to activate electrical impulses in our body. So we have a positive charge. White always goes on right. Just remember white right. And then if you can't remember which side the brown goes on, just say white right. And then you'll know the brown goes on the left. And David Schmidt has studied a lot of different acupuncture points in our body. Those are energy meridians in our body. And the Eastern medicine world looks at those. In Western medicine, we tend to want to go, we don't believe in that, but we do. I just told you how we do EKGs on our heart. We do EEGs on our brain, right? Because we know there's electrical impulses in our body. And the Eastern medicine knows about many more of these energy meridians. And so when you get your energy patches, you will get a little booklet like you do with all the patches that shows different places that you can place it throughout the body. This is a great spot here, okay? David Schmidt says he uses lower body, 2 on the lower body and 2 on the upper body of the energy enhancer patches every day. And if you put them on the lower body, you can put them on your heel, on your toe, on your ankle, on below your knee. And so you can sort of experiment with them as far as getting that energy, that electrical impulse activated in the body. That is what helps the heart to have the good variability. That, of course, makes the heart muscle to be healthy and good, because going back to one of our earlier questions, what is bad for the heart? Well, it's our coronary arteries that get blocked, okay? It's an electrical problem like what my husband had when the heart just stops. And also, we have valves in the heart that move the blood through the 4 chambers of the heart. And if those valves are floppy, then you have a problem. And that was my husband's congenital defect that ultimately caused his heart to stop. And so we want to have a healthy heart, and our heart is a muscle. And so the energy enhancer patches actually work to help make our heart healthy. And so that's one area of the body they work. And they work through this electrical connection, electrical stimulation of energy pathways in our body.
Excellent. That was a fantastic explanation. And so it just comes down to we are tapping into the electrical circuit in our body and enhancing it, and that's why it's negative and positive.
Exactly.
Okay, perfect. And you touched on clogged arteries being an issue with the heart. How do we get clogged arteries, and what are they, and what do they do to our heart?
So with age and with stress and with bad eating and poor exercise habits and toxic environments, all of those things we know take a toll on our bodies. And they take a toll on our vessels in our body that help transport blood. And remember, blood carries oxygen. So it's our life force. our blood moving through our bodies is our life force. It keeps our organs and our tissues healthy. And so we don't have to have a lot of blood flow down to our foot. And so if somebody has to have an amputated foot, they can still live. But if you don't have enough blood to your heart or your brain, it's either going to be very damaged or you're going to die. And so we know that blood flow is important. And so all of those arteries that carry blood to the heart, if the heart doesn't get enough of that blood because they're blocked, we have a number of different vessels coming into the heart, and our heart can continue to try to make what we call collateral vessels. Ones, when some get blocked, they make others. But over time, if we don't have enough blood getting to our heart, it becomes damaged, and we have a greater risk for a heart attack or a stroke, because that, of course, goes up to the brain. So when our arteries get damaged, it starts with what we call plaque, and buildup of plaque in those arteries will sometimes break off. And when that plaque breaks off and clogs a vessel completely, so there's no blood flow, that's when you get a heart attack. Or if it throws that plaque up even further up to the brain, that's when you get a stroke. And so that's why the vessels are so important. And there are there are major ways that we keep those vessels healthy as we live and as we age. It's basically through lifestyle. And so you probably have a doctor that maybe will check your cholesterol, but there are many other things, including inflammation, that can contribute to that. And that's what we do in functional medicine. We check a number of inflammatory markers, as well as cholesterol and some other things, to see where are we here. Sometimes we check calcium and look at that in the body too. And so some of those things can contribute to causing artery problems, particularly what we eat. The more junk we eat, the more bad fat, the more cholesterol we bring in through animal products, the more likely we're going to have damaged vessels. So we have to, watch all of that with our lifestyle.
Sure. And so the difference between a stroke and a heart attack, what I just heard you say, because I've often wondered that, I know the stroke is affecting the brain, but what I really just heard you say is that they're kind of the same thing. It's just, where did the plaque get lodged at?
That's correct. That's correct.
Okay. So the heart, with the heart, the plaque would stop part of the artery and the blood flow, but with the stroke, it's still coming from the heart, but it's going to lodge in the brain and then stop blood flow to the brain.
Or coming through the vessels, yes, that feed the brain, because the brain, again, has to have a good blood flow too. And we know
Sure.
that people that get dementia, often the vessels, they get blocked or damaged or tangled up with other proteins, and then don't work as well for the brain too. Yeah.
Right. So in effect, whether you suffer from a stroke or a heart attack, the root cause was typically the same thing.
That's right. That's right. And as our vessels age, and as we look at genetics, some people have there are genetic tests we can do to see, do you have a genetic propensity for heart disease, coronary artery disease? Do you have a genetic propensity for stroke? And as we look at that, not only with your genes, but look just in your general family history, did you have a mother or a father who had a heart attack in their 40s? Many people will have heart attacks in their 70s, but if was it early on, then you may have that genetic predisposition. And so then we know to be even more aggressive in how we treat it preventively. And that's what I love. When I was doing my medical training, and I was in internal medicine at that time, and I spent time in the ICU, and I would come home every night on that long rotation, and I would cry all the way home, because those people in the ICU were being kept alive artificially, basically. And it was so sad, because I thought, if only, many of these people, if we could have seen them sooner, they wouldn't be here. And that's where I got even more heart for prevention. We want to try to help people to not have the heart attack. My first husband was actually under the care of not only my son, but he had his partner was following, and he was doing great. And but it just one day, one thing. And so there's some things you just do the best you can, you can't prevent. But most of us can do a lot in preventing ourselves from getting diabetes or heart disease. And that's through our diet, our lifestyle, and taking any supplements that we think are needed. And of course, our big supplement here in Lifewave are the patches, because we're taking in no medicines, no drugs, no stimulants. We're just encouraging our body to do innately what it knows to do, but sometimes it gets a little misguided in our toxic world.
Yes, absolutely. And we're all so thrilled here at Lifewave to be able to add X39 to that toolbox.
Mm-hmm. Yes,
and so
for
when,
sure.
Yes. And so when we do add X39 to the toolbox, I know we have some studies on the heart, on what it specifically does when we allow our bodies to have that environment. Can you go over what it specifically will do to help the heart, and how that study describes that?
I'm not sure I know the specific study you're asking me about. And if anybody on the call does, please speak up. We have more than 80 studies. And how many of you have looked at the new website? It's so cool. And if you've noticed, when you look at the studies, that's the first place I went, because I wanted to look at the research and the patents. And they're now put into like the patch and the studies done on that individual patch. And each patch has its individual studies that have been done on it. And so we know that stem cells, so my clinic and I personally have used stem cells in the past. And many of you that have been on this call know that story. So I'm not going to go into any details on it. But one of the reasons we use stem cells was to help restore heart function, vessel integrity, we call that, because the lining of your vessel, it starts out to be just this luminous, shiny, slick, beautifully smooth lining of your vessels. And then over time, you get some plaque and it starts getting bumpy and it's not so beautiful. And then you get inflammation and it gathers and you get more plaque. And so we know that stem cells actually help rejuvenate that inside lining of our blood vessel. The stem cells were very good for people post-heart attack to help be restorative, help decrease inflammation, which inflammation is the root of heart disease, right? So I can speak to that part of it in knowing that when we're activating our stem cells, we're doing all kinds of good things in the body, but specifically for the heart and the vessels that feed the heart with the blood flow that is life force for our heart. We are restoring that to a more youthful level before we had so much damage. And so that is why we use the X39. It also helps organ integrity so that our organs, and the heart, of course, is one of our organs, are able to have the right oxygen supply, the right blood flow, the right ability to have a variability of the heart rate, to pump through the valves, to keep the muscles stronger, because as we age, our muscles get weaker, including our heart muscle. So the X39 is a base not just for the heart, as we know, but for other organs, for our entire body. But we're talking about the heart today. And so it will be very, very helpful. In fact, I was thinking about this morning. I thought, oh gosh, I wish my husband passed away now 8 years, about 8.5 years ago. And I was thinking, boy, I wish I'd known about the patches back then. I wonder, what would have happened if we'd have had any difference there. Yes. Probably so.
Yes, I'm really sorry for your loss. And
yeah.
I've often felt the same way with loved ones. Oh, if we just
Yes.
would have had the patch back when that was occurring, what could have been prevented? So,
Well, and I have to speak too now because I remarried 6 years ago, and my current husband is also very healthy. That's a value that I would always be looking for in a mate. And he's very healthy. He runs several miles a day. And, you know, we eat healthy. We do take supplements, everything you can do. Sort of like, you know, life put me through a similar circumstance. But he had, this time though, my second husband had a very mild heart attack. In fact, we didn't even know it. He thought he was having indigestion. He had just been surfing, and I thought he'd gotten too much water, you know, and ultimately he then went out to run the next couple of days and couldn't run more than a few steps without feeling breathless. And so, but he has recovered so quickly. In fact, even from the beginning, they said, your heart is still pumping the amount of blood it needs to pump. They call that the ejection fraction. It's not lowered. And basically, it looks like you have no damage, even though you had a heart attack in this part of your body. And through all of this, we found out he has a genetic predisposition. His brother had to have quadruple bypass surgery and all this. But I do believe with my second husband that everything we've been doing, including the Lifewave patches now for about 10 months, we've been doing those. I think that's made a huge difference. And he is now running better than he has ever run in his life. And I mean, you know, we have to attribute his main patches that he uses are 39 and 49, carnosine and glutathione. Those are his big ones. And so I believe in it with all my heart.
Absolutely. Well, I'm so glad he's heart healthy and happy.
Yeah, it's pretty amazing. It's really great.
And so you mentioned X49. And so that's our latest patch. Can you talk a little bit about the difference between X39 and X49 in context of heart health?
Yes. Excuse me. I'm talking too much. I don't normally talk this much. So I think that X49 is a great partner. I've got it under my belly button today. I patch myself up because every time I hear about a new patch or something new, it sounds good. I want to use it and try it. And so the X49 is great for performance and workouts. We know that it activates something called AHK copper in the body. And remember, our GHK, our AHK, those stand for amino acids. Those letters stand for amino acids in our body, and they're short chains of 3 amino acids in our body. And so the AHK copper is a little bit more into tissue repair, and it specifically looks at the heart and the brain a little bit more. And of course, that has to do overall with performance. And by performance, we mean, you know, working out, able to recover. If we've just had a very busy day, you know, you don't want to just feel like you collapsed at the end of every day and you can't make it. And so the X49 is rejuvenative. We think even with cell phone exposure, cell phone tower exposures, it's very exciting to me that when we can combine those two together. We have studies on X49 that show that, again, we're using fat, burning fat into muscle. And of course, that's going to, again, give us the energy of our heart. Also, the mitochondria, and I mentioned this before, but I love to talk about mitochondria because that's just an organelle in your cell. Now, mitochondria is basically given to you by your mother, not your father. So women love this. So any men, you're still contributing. The only thing that makes the baby come together with the egg, and that's your sperm. But sperm do not have much cytoplasm at all. And cytoplasm is just sort of like the jelly-like substance in our cells. And so we really don't think that the males contribute to the mitochondria. The egg is full of cytoplasm and has lots of mitochondria in it. So you get your mitochondrial DNA, basically, genetic components of your mitochondria from your mother. And mitochondria is your powerhouse of the cell. It is literally your rocket fuel. That's where you make ATP. And you might remember studying about this long cycle in high school biology. And you have ADP and you convert it to ATP, your rocket fuel. Okay, so that is what the energy enhancer patch does. And that's what X39 and 49 also are augmenting, is that mitochondrial function. And we know that the mitochondria of the cell is what keeps us youthful, and that rocket fuel is what gives us our energy. And so when we're using X39, X49, and energy enhancer, it's an electrical stimulation, but it's also a mitochondrial stimulation. And that is, the best of all worlds. And yet we're not using stimulants or drugs to get that effect.
Yes. Wow. So I didn't, I'm getting a really great appreciation for energy enhancer patch. Let's just say that. I had no idea that it did what it's talking about. You're talking about the electrical impulse and the heart rate variability. I did know that it took fat and burned it into energy, but I didn't know the other aspects of how it could be really contributing to your heart health. So if you were to name, I would have assumed it would have been Eon and Carnosine. So
yes, Eon and Carnosine are important too. I use those. So does my husband. Yes. But Eon, in particularly, it's going to help to quell inflammation. And that allows our stem cell patches to work better, because stem cells are just our God-given hummingbirds. They literally look for inflammation in the body. They move right to that spot, and they begin to quell it by exuding, putting out many different chemicals to calm inflammation. So Eon is a great tool for that. Carnosine also works with the heart, but carnosine is an antioxidant. So remember, we've got all these pathways in the body, right? So energy enhancer is looking at the electrical pathway. And that's why we have two of them that we wear on our body. And it stimulates the mitochondria for energy. The carnosine is going to give us strong antioxidant. That's what carnosine is. Now, again, remember, I always have to remind myself, I'm not taking carnosine as a supplement when I use the carnosine patch. I'm simply activating that in my own body to be more effective and more active. And so I love that, because for me, I'm super, super sensitive to supplements. It's so many things that I try to take. It doesn't work. I get the side effect from it rather than the benefit. And so I love that with patches, because it just lets my body apparently is very particular, and it doesn't want a bunch of stuff from the outside. And so, but when I gently stimulate it from the pathways to be reactivated and to remember who they are and what they're supposed to do more effectively, then it works for me. And so carnosine, I love to wear carnosine at night. My husband wears it in the day, but it makes me a little sleepy. And so I like to wear it at night, because I figure then that helps for even better repair, because that's what we do at night. We're supposed to be repairing when we sleep, right? But carnosine works as an antioxidant and of course, that means it'll help quell inflammation. It'll help increase oxygen to the heart. So it's a different pathway, but it's also very helpful for the heart. And you can wear it literally right on the heart. That's a great place to put it.
Yes. When I suffered from some COVID symptoms years ago, I used carnosine to bring my brain back online and allow me to start, lifting that brain fog and having brain structure. When I put it on, within about 30 seconds, I could feel that I could think clearly the words, and they could come out my mouth in an articulate sentence. So yeah, I love that. I love that patch. And I love how you talk about, you really talk about the patch versus a supplement. And it's really just allowing our body to heal itself. And who doesn't?
That's right. And sometimes we do need some supplements to help it work, those patches to work better. And so that's why it's important to check your mineral levels, to check and be sure you don't have toxic mercury and arsenic and things like that in your body that are holding you back. And so if you have a patient or a client or even yourself or a family member that says they're not seeing any benefit in a particular patch, you should really encourage them to have those levels checked, because sometimes you need magnesium, or for example, GHK copper, AHK copper, the X39 and 49. If you don't have enough copper in your body, the copper is the escort molecule of that 3-chain amino acid into your cell. So you've got that 3-chain amino acid, but it needs to be brought into the cell to be truly effective. And we use copper as that carrier molecule. If you don't have enough copper in your body, then it won't be as effective. Now, the problem is that then everybody could think, oh, well, I'm just going to go out and buy copper. But the problem with that is that too much copper can be toxic. And so you want to have your balance of minerals. You want to have zinc and copper balanced. You want to have plenty of magnesium. And I can just go down the list of the minerals that we need. And so they need to be in a nice balance. One of the things I tell my patients is if you just use a little mineral salt every day in a glass of water, like Himalayan pink salt or Celtic sea salt, and just 1/4 of a teaspoon, you could use more if you wanted, but 1/4 of a teaspoon in a glass of water, that gives you about 60 minerals every day. That's a low level. So if you're really needing more, there may be a time you need to take some copper, or maybe a time you need to take some selenium. I had my minerals, I have those, I check those every year. And I didn't have any that were too low officially, but my selenium was on the lower end of normal. So I take a little selenium every other day. I don't want to get it out of balance, but I'm just giving my body that support. So it's really good to make sure you emphasize that to your patients, and then be sure they're drinking plenty of water, because the patches will not be very effective or as effective if you're dehydrated, because the cell then can't function, can't bring in those amino acids as well.
Right. And also dehydration is really going to affect the mitochondria. Is that correct?
Yes. Well, it'll affect everything about the body, but absolutely you cannot get the benefit from the energy enhancer patches or the X39, 49 like you need if you're not well hydrated. That's right.
So if you were to just say, if you were to choose your 4 favorite patches for the heart health, what would they be?
So we've talked about X39, and we've talked about energy enhancer and carnosine. And then I just always want to pair Eon with X39, because, as I mentioned earlier, we want to try to get down some of our inflammation so the stem cells can work even more effectively. So that would be my patch for my combination if I were to put those 4 together specifically for heart health.
So the X39, energy enhancer, carnosine, and Eon.
Mm-hmm.
Excellent. Fantastic. Well, this is such amazing information. I mean, I know everybody on this call is just so health orientated, and they just are, thirsty for more information. And you provide that every Thursday when you're on. So thank you so very much. Any last words before I open it up for questions and answers?
No, let's open it up. That sounds good.
Great. Okay. So
I have a question.
Great. Go ahead, Bob.
Thank you, Dr. Patty, first of all. And my question would be, could you give us an idea in general terms about what your diet looks like, and what you avoid and what you use?
Good. That's a great question. So my husband, when he had his mild heart attack, that was last June. And at that time, I reached out to one of my friends. I helped to manage a clinic in Brooklyn, New York. And I reached out to one of my friends there who recommended a holistic functional medicine cardiologist. And so we began seeing him. In that process, I connected with Dean Ornish. Some of you may have heard of Dean Ornish. He's written many books. He's been around for quite some time, and he had an intensive cardiac rehab program that we decided to do. And that program emphasizes plant-based diet. And so in the meantime, I was a vegan actually for 15 years. And then I started eating a little bit of fish. When I met my current husband, we started eating some meat, grass-fed, always organic, wild caught fish. So if you do eat meat, you want to make sure pastured eggs, you want to make sure it's all really high quality, and you don't need a lot of it, not only for your heart and your arteries, but also not for your kidneys. We think we have to have all this protein in the United States, but that's really a marketing ploy, and too much protein is hard on the kidneys. So you want to always have that balance. But for us, what we started doing completely again was I went back to, and for my husband the first time, doing strictly a plant-based diet. And so we get all of our protein through plants and through legumes and other ways that you can get protein outside of meat. So what you want to remember is this: if you have a family history for heart disease, or you've tested your genetic, and it's not expensive to do that, and you know that you have that, you might want to really consider mostly, if not entirely, a plant-based diet. And here's why. Because the only way we bring cholesterol into our body is through animal-based products. So that would be like meat and dairy. And if
Can you say that part again? The only way we bring.
Yeah.
So we have cholesterol. Thank you for that question. We have cholesterol. We get it two ways. The first way we get it is naturally. Our liver makes it. Cholesterol, we have to have cholesterol to live. Cholesterol is the building block for all of our hormones, for the membrane around all of the neurons in our brain. We need cholesterol. And so when we let our body make its own cholesterol, it would be extremely rare that you would ever have too much cholesterol in your body. Where we get too much cholesterol is we bring it in also then from the outside. And if you're a person that thinks you need to eat meat at every meal, you need to eat meat even every day to get your protein, you need to drink your milk, all of that, then you're going to have a higher cholesterol level because you're bringing cholesterol in from the outside. So people that have a problem with coronary artery disease, because we know too much cholesterol causes inflammation, which causes plaque, and that causes coronary artery disease, blockage, heart attack, and stroke. So you want to bring in as little cholesterol as possible. Keep your cholesterol nice and low on its own. If you do choose to eat meat, then you just want to have, I tell patients, they go, oh, organic grass-fed beef, that's so expensive. It is more expensive, but you just need a small portion. 2, 3, maybe a large man, 4 ounces at the most. We don't need 6, 8, 10, 12 ounces. You go out to a steakhouse and they're trying to give you a 16-ounce ribeye, we don't need that. That's bad for us. But little bits of that you may be able to tolerate. Milk protein can cause a lot of inflammation in the body, so you need to be careful about eating dairy, cheese, and those things. So for what we do is we eat plant-based diet. So that means no dairy. That means, and we choose to eat no gluten as well, because gluten has an inflammatory one. So we have a pretty, you might say strict diet, but I see it as life-giving. And my husband's numbers are incredible. He's running better than ever. And he said, he's Italian. He said, never would I've ever thought I would give up meat. So, you just do what you think is best for your health and what works. But that's what we do at our house now.
But you do eat plenty of sweets, I'm sure, right?
No sweets.
I'm being facetious.
Exactly. I wish. I have a terrible sugar tooth. And I have to I'm like an alcoholic. About alcohol, I have to stay away from all sugar or it spurs me on. And that's why I like the patch SP6, because that helps with cravings. And it's amazing. It really is good. So, but yeah.
I want to share one thing, Kathleen, if I may. So I have a business partner. Her name is Amy Holmesy. and she's kind of hard to ignore. And so about 10 years ago, she got me off of sweets.
Oh,
And now I have a sweet of any sort. My body just tells me, no, stop, don't do this. It's really incredible, just incredible how when I stopped sweets, I did it cold turkey, and I had sweats and shakes for 7 days.
yeah. That
So I
doesn't
must have been in
surprise
bad
me.
shape.
Well, you
Yeah.
know, rats prefer sugar over cocaine, and all the studies they've done. It's very addictive. And so,
Yeah,
you know,
I've always thought that too. Yes.
yeah, yeah.
No, I'm teasing. So,
Great.
but no, thank you very much.
Yeah, thank you
And
too
the
for
only other
sharing
thing,
that.
yeah, it's kind of neat though. I must say that you said you took into consideration when you were looking for a mate, a healthy. Now, see, I'm looking for one that's not very healthy, but very wealthy. So that's kind of,
Oh,
you
that's
guys know.
going to be very successful, I'm sure.
Awesome. Thank you for your question and your humor, Bob.
Yeah.
So Ginny has a question. Ginny, do you want to unmute yourself and ask your question?
Hi, Dr. Patty. Thank you.
Yes.
Someone was trying to help me in the chat, but the Himalayan salt, I gag when I try and drink it. Could we get the benefits if we put it on food
Sure.
or not?
Yeah, no, absolutely. You can sprinkle it on your food. And yeah, some people don't want to drink it, so you can sprinkle it on your food. The only thing, there are a few people that do have sensitivity and it'll increase their blood pressure. So it's something, if you do have any, again, we go back to sort of our genes, genetic propensity for blood pressure. Most of the time, the mineral salts will not increase your blood pressure. But for people that have that genetic propensity, it's literally a pathway in your body that makes you hold on to salt. And if you hold on to salt too much, then what that does is that increases the fluid in your body, and that can then make your blood pressure go up. So you do, that's the only reason to watch any kind of salt. But this kind of mineral salt is not like table salt that's just sodium chloride. It's all the minerals and it's balanced. So usually it's okay, but I'm just putting that out there for you to, make sure you look at if you have that problem.
Thank you. I got rid of all our regular white salt. It's gone. I won't even let my son use it, who's 20 and healthy, but yeah, it's gone. Thank you so much.
Yeah, sure. And the other thing that's good is that, we iodize our table salt so that people could get enough iodine. And so sometimes when you stop eating table salt, which I highly recommend because it's not as good for you as mineral salt, then you're not getting any iodine. And so you can eat things like sea vegetables, like kelp. You can buy dried kelp. Kelp is very strong taste and smell, so some people don't like that. You can buy dried kelp that doesn't have that, sprinkle it on your food. But your mineral salt also has iodine in it. So that's another thing that makes it really nice, is you're still getting the iodine.
You're amazing. Thank you.
Thank you.
Excellent. Are there any other questions anyone would like to ask?
Give me just a minute, you guys. Hi, I have a question.
Sure.
Hi. Hang on just a second. I'm walking out of a meeting. So the SPX or 6, I'm sorry, the SP6, yeah, is when I use it, I don't have sugar cravings usually, and I'm getting more sugar cravings. What do you recommend? And then second thing was, for people that are diabetic, for children that are taking insulin, what is the protocol for that?
For people that are diabetic, that are taking insulin, what's the protocol for what now with that?
She's insulin, she's taking insulin, or she's, 13. And she's a diabetic, type 1. What is it that you would recommend? What is the protocol still? The glutathione, the X39, and the Eon?
So we don't make
Carnosine?
recommendations for children because David Smith's really clear on that we haven't done the studies. We think it would be safe. There are many practitioners that do use it with their children, and I would encourage you look at that. You can go on, oh, I haven't done that. What is the app on the phone that we have?
In touch.
Yes, and well, yeah, I'm actually talking about the one.
Telegram?
Yeah, Telegram. You could go onto Telegram and you could type that in and you might find other people that are doing that, but we can't make any recommendations for that. Certainly diabetic type 1 should be working very, much on blood sugars and all of that, with the endocrinologist or the doctor, but we can't make recommendations on that because
Okay.
we don't have the
So what about
studies.
the SP6?
Yes.
That may having more sugar cravings when I put them
How
on
long
my
have- Yeah, okay, so you're putting it on your abdomen?
No, I was putting it on my leg, foot. I've changed it around a couple of
Okay,
places.
yeah. The place David Schmidt recommends is that spot that's on your left side. It's one of the few on the left side, and you just bring your thumb up and where you feel the sore spot, you put it there.
Mhm.
Now, I will tell you, I had a very similar experience. So I always tell patients, anything that can work one way could work another, right? And so when I first started SP6, and I was so excited because I go in and out of my brain. I have symptoms of multiple sclerosis. And sometimes if my brain's not quite as whatever up there, I will feel like, oh, I've got to go have a piece of cake,
Don't-
and,
never craved
and I think
here.
about it.
Yeah.
Yeah, exactly. So, and I first started that, I thought it made me worse as well. However, I thought, well, it's probably not really making me worse because I was pretty bad when I started. You could give yourself a number when you start and then see, but maybe it was making me worse. It certainly wasn't helping. And it took me over 2 months. It wasn't quite 2.5 months when all of a sudden the craving went away. Okay. Now I have found for me that I pulsated. I think if I wear it now this is just me, if I wear it too many days in a row, then it loses its effectiveness and I start feeling the craving again, even while I'm wearing it. So for me, what I do is I use it normally 3 times a week. You can move it around. You could try it different ways. You could even use it a half a day, and then put it on another half a day. But for me, I use 3 days a week. And then if I start my craving seems worse, I wear it several days in a row. And then I'm doing that. I'm in a cycle now where I've been wearing it every day. I'm on my 4th day and I have nothing is going on. So I have to pulsate mine a little bit. I would ask you to try to give it time. We always say we've got to give the patches time. Now, if you just think it's making you so much worse, you can't do it. I understand.
Yeah, well,
then I
that's the point is I
pulsate it.
guess I don't really have a sugar craving and
Mhm,
my AC1's really good.
mhm.
So I'm wondering if it's not maybe something that I should
Oh.
advocate for myself.
Yeah, sure. Then I'd look at something else for a while, and maybe that's not the best one for you. And so, sure, we have so many options. If you feel like that's not helping, it's supposed to be really helpful for balancing hormones too. But I
know,
think
that's
the
what I
other
took.
patches can do that, and as well. So
Okay.
I just step back from it for a while and maybe reintroduce it a little bit later again and see if it doesn't help.
Thanks.
Mm-hmm. Sure.
Thank you, Rosalie. Randall, do you have a question? Would you like to unmute yourself? Ask your question?
Yes, thank you. Can
Yes.
you hear me okay?
We can.
Okay. Yes, I'm recently have just found the X39 through some wonderful people that wanted to help me. And I've recently went through an open heart surgery, had a 3-way bypass. I would not recommend that to anyone. It's
Yes.
not good, but it's better than the alternative. But when I wound up, I do have let's see, the doctor called it a right bundle artery blockage. I have some tiny arteries on the right side of my heart that too small to stent, and I'm having a lot of pain. I have to take nitroglycerin tablets and whatever. And I really would like, just some information there to see where to go from what.
Right. So again, we don't give any medical information specifically before I could give you anything like that, and I do sometimes have people that reach out from this call, and I don't mean to be cold-hearted, but I have to have a lot of information before I can make recommendations, and I have to establish a patient-doctor relationship. So I can't say anything specifically, even for right bundle branch block, but that is something common, and that's a bit of an electrical problem as well. And so again, if you can find a functional medicine doctor, a functional medicine cardiologist to work with, that's good. I would say in the meantime, what you look at are things that are really good for heart in general. So I'm just giving some general things about the heart. The main supplement for the heart that you want to take is coenzyme Q10. That's a very important coenzyme that helps the heart to function better. And if I had a patient that had a major problem like you do and the history you have, I would say absolutely, I'd go to a plant-based diet completely. And I would use the patches that we've talked about, and, you know, officially in conjunction with your cardiologist. But if you have a functional medicine cardiologist, they'll be a little bit more on board.
Thank you. And I fully understand what you're saying there about the recommendation. But my big problem is finding a good functional cardiologist. Is there any kind of websites or anything that any of you might know of that? Because I'm in South Alabama. You couldn't tell from where I talk, but I'm from the deep South.
Yes, so I'll tell you what I can do. I will put that in the chat of the one that I think is super, that my husband uses, and he's really amazing. So I'll, if I have time today, I'll do that. Or what's the, I know we've got to stop now because it's 10 o'clock. It'll 2 minutes. Okay. All right. So give me just a minute so I can pull up his email for you, and I'll just put that in the chat, because really this does relate to today, doesn't it? So much, because we're talking about the heart, and this is a functional medicine cardiologist, and he has a sidekick. He's actually, but he does remote. He's up in New York, and, you know, we're in California, you're in Alabama. But so he does remote work, you know, where you do Zoom, which is great. And he's really wonderful. So I'll put that in the chat. So maybe talk just a minute so I can quit talking.
Yes.
Someone else can talk.
Yes.
Yeah.
I'll take over. I can talk.
Yeah.
Thank you, Dr. Patty. You're just helpful on so many levels. And so we have 2 more questions. They're going to be quick, and please do direct them in more of a general question so that we can stay with compliance. Okay. So Janice, go ahead and unmute yourself and ask your question.
I just heard the Dr. Patty say that she had a propensity towards MS, and I have a brand partner. So I'd just like to know what she does, which might also be something that I could talk to with our brand partner here, who is dealing with that, who just started. And she's doing the X39 and the Aeon, and has already felt more energy, which has just been extraordinary for her in the first week. So I just want to know what you do, and then we can adapt from there.
Yes, sure. Okay, so just give me a second here. I'm still working on getting this for you, and I almost have the information.
And also to refer back to Randall's question, Dr. John Harmon had similar situations, Randall. So if you're, you can connect into Telegram and look at some testimonials about that and see what he was doing for it. So that's always a great resource, is the Telegram, where you can find similar people having similar experiences that you can glean information from.
No, exactly. Okay, I've got the email now, and I'll put it in the chat, and then we'll have that. And this is the person that you can reach out to that will help you, and I'll put his name in there too. Okay.
So again, Denise, We can't recommend specific patches for specific diseases. That is not what the patches are. The patches allow your body to come into homeostasis, balance, and coherency on physical, mental, and emotional levels. So it's giving your body what it can to heal. So we can't specifically
know that
say
we
about
all
ALS.
share. I know that we all share what works for us. So I thought, you know, people say,
Yeah.
I had this and this works for me. So that's the context I was asking.
Sure.
Absolutely.
I
Jess.
basically patch myself up from head to toe. I use about 4 to 5 patches and during the day and about 4 to 5 at night. And I think that they're all helpful to help sort of turn things around in my body, stop inflammation, which we know MS or any disease that's autoimmune, eating clean and healthy, like I've already spoken about, and making sure I move my body constantly, because sometimes it doesn't think it really wants to move so much, or I feel a little imbalanced, or my legs feel weak. I say, nope, we're not done yet. We're getting up, we're walking. And so I do lots of walking. But my regime that I do in the morning is I do X39 and 49 and Eon always every day. And then I alternate between glutathione, SP6, and energy enhancer. And I every day I do Nirvana in the morning. And then at night I do
Carnosine.
I do carnosine. I take that back. I do Eon at night. I try to sort of alternate a little bit. So I don't do Eon in the day. I do Eon at night, along with Icewave. And some of you've heard my testimony on Icewave and the pain that I have, and how that helps me so super much. And I do Alavita. Those are my standards at night. And then I alternate carnosine. I don't use it every day. And I do it at night. And let's see, did I forget any patches? If I forgot one.
Carnosine is supposed to help the brain, which is really, and the nervous system, which are integrally involved with things such as MS and other things.
I know, and I think NAD is really important. And the energy enhancers, I forgot to say that, they activate NAD in the body too. So glutathione is one pathway of detox in our body. NAD is another. And I'm in an NAD study group. We do intranasal NAD, we do NAD IVs, we do all of that with some of our patients. But again, there's needles and it's expensive. Well, intranasal is not, but it doesn't have a needle. But still, what we're doing, energy enhancer activates NAD. So if you're doing energy enhancer and glutathione, you know, like I do, I alternate those with SP6. You're getting all those 2 major detox pathways in your body activated. And so you may need to ease into energy enhancer, just like you have to ease into glutathione. And what I mean by that is that you take off half of the little backing, so that, you know, and you just stick it on and you just do half one day. And then you can take the backing off and use it then another day.
Why do you separate? Why do some people just have, it's too much glutathione?
Because it's detoxing your body, so it's stimulating your glutathione. And if you're real sensitive, like I am, and like many of my patients are, and our bodies just tend to overreact a little bit if you have autoimmune. I'm not usually sick with any of the flu, but you know, then now I have these symptoms of MS, you know, so we have to be careful. Yeah.
Gotcha. Okay. And you don't do the carnosine and glutathione at the same time? You alternate them?
Well, I might, if it happens to be a night, I'm going to do carnosine, and then but I do glutathione in
I've
the
been
day.
doing them every other day on the same day. Anyway, I went along. I'm so grateful. Thank you so much. You're so brilliant, so kind.
I know. You
I just
too.
love everybody who is so generous of spirit in Lifewave community. Thank you so much.
Yes. And save your questions. I've got to go too. So I know all of you need to go as well, but save your questions if you have more, and you know, maybe we can just have a time where we just do Q&As. I'm happy to do that too. So thank you guys. And I try to get here as much as I can. I'm not here every week, but I do try to come as much as possible because I love to teach and I love to share and I love to get the energy from you guys. So it's a wonderful win-win for all of us.
Yes. Thank you so much. Thank you for your question, Janice. And once again, Dr. Patty, we've learned so much. Thank you for being our guest, and we hope to see you again here soon. So
Thank you. Thank
everybody
you.
have a blessed day. Goodbye.
Thanks, Kathleen. Thank you.